The latest Twitter Files thread exposing the inner workings of the pre-Elon Musk era dropped on Monday, disclosing how pharmaceutical companies pressured the social media giant to censor activists voicing generic COVID-19 vaccine advocacy. Let's find out more together. Twitter owner and CEO Elon Musk waded into a discussion about COVID-19 boosters in a tweet on Wednesday, with the billionaire claiming that it, quote, isn't clear whether, all things considered, a second booster helps or hurts. Despite a surge in COVID-19 cases nationwide and waning immunity against the disease, Musk's remark comes at a time when less than 40% of people aged 65 and older have received a bivalent booster, according to the CDC, with officials blaming misinformation for the low number of vaccinations. Updated bivalent boosters designed to protect against the original coronavirus strain and circulating Omicron variants became available in September for people 12 and older, in October for children 5 to 11, and in December for children 6 months to 4 years old who completed the Moderna vaccine primary series. The Centers for Disease Control and Prevention's recommendations for who should get a second booster or fourth injection of an mRNA Pfizer or Moderna vaccine vary depending on age and whether a person is moderately or severely immunocompromised. Available data suggests that while bivalent boosters may not offer strong protection against breakthrough infections, they help protect against severe disease, hospitalization, and death, especially in vulnerable populations. Before the approval of the bivalent booster, World Health Organization experts said in a statement last August that, quote, there is increasing evidence on the benefits of a second booster dose of vaccines in terms of restoring waning vaccine effectiveness. Evolving evidence from studies suggests that additional protection of the most vulnerable populations, at least for several months, is likely to be achieved through administration of a second booster dose, although follow-up time for these studies is limited, the statement continued. With the new bivalent boosters targeting the COVID-19 strain responsible for most cases in the US, experts had hoped they could better protect against infection. However, two studies, one by researchers at Columbia University and the University of Michigan, and the other by researchers at Beth Israel Deaconess Medical Center in Boston, found that bivalent boosters produced an antibody response comparable to, but not better than, the original monovalent vaccines, meaning they reduced incidence of death from COVID as well as the severity of illness, but did not reduce the likelihood of transmission. But for older, more vulnerable populations, a bivalent booster may effectively reduce severe outcomes from infection. An Israeli study on Pfizer bivalent boosters published last week but has not yet been peer-reviewed found that participants 65 and older who received the bivalent vaccine had significantly lower hospitalization and mortality rates from COVID-19 up to 70 days after vaccination than those who did not get boosted. A study involving nursing home residents published in September found that, quote, receipt of a second mRNA COVID-19 booster dose during circulation of SARS-CoV-2 Omicron subvariants was 74% effective at 60 days against severe COVID-19 related outcomes, including hospitalization or death, and 90% against death alone compared with receipt of a single booster dose. For adults 18 and older, a report by the CDC found that bivalent booster doses provided additional protection against COVID-19 associated emergency department and urgent care encounters and hospitalizations in persons who previously received 2, 3, or 4 monovalent vaccine doses. Common side effects reported after getting a booster are similar to those reported after a primary shot and are usually mild and temporary, including fatigue or pain at the injection site. The CDC says serious side effects that could cause long-term health problems are infrequent following any vaccination, including COVID-19 vaccination. When the Food and Drug Administration first gave bivalent boosters emergency use authorization, some were concerned about the lack of human clinical trial data. However, updated information from clinical trials has since become available. In November, Pfizer released data showing that the bivalent booster's safety in human adults was favorable and similar to its original monovalent COVID-19 vaccine. Moderna reported in November that its human clinical trials had no new safety concerns. A recent study funded by the European Research Council also supported the safety of a second Pfizer booster and found that the second booster was not associated with any of the 25 adverse events investigated. Health officials have been trying to overcome vaccine hesitancy since the beginning of the pandemic, a problem that an uptick has been exacerbated by misinformation on Twitter. Shortly after Musk acquired the social media platform, the company announced that as of November 23rd, it would no longer enforce its COVID-19 misleading information policy, which involved labeling or removing content with misinformation about COVID vaccines. Though Musk opposes vaccine mandates, he told Time magazine in 2021 that he and his eligible children were vaccinated and that the science is unequivocal. In 2020, it was clear that the pandemic would require rapid innovation. Early on, there was a push to make the solution equitable, an international partnership to share ideas, technology, new forms of medicine to rapidly solve this crisis, tweeted investigative journalist Li Fang. But global drug giants saw the crisis as an opportunity for unprecedented profit. Behind closed doors, Pharma launched a massive lobbying blitz to crush any effort to share patents and IP for new COVID-related medicine, including therapeutics and vaccines, Fang wrote. Bio, the lobby group that represents biopharma, including Moderna and Pfizer, wrote to the newly elected Biden administration demanding the U.S. government sanction any country attempting to violate patent rights and create generic low-cost COVID medicine or vaccines, he added. Fang wrote, the global lobbying blitz includes direct pressure on social media. BioNTech, which developed Pfizer's vaccine, reached out to Twitter to request that Twitter directly censor users tweeting at them to ask for generic low-cost vaccines, attaching an internal email within the social media giant. He said the Twitter representatives responded quickly to the pharma request, providing additional receipts. He also noted that the potential fake accounts that Twitter monitored for protesting Pfizer were actually real people, one of which was a 74-year-old retired bricklayer in the UK. Separately, Pfizer and Moderna's lobbying group, Bio, entirely sponsored a specific content moderation effort established by a contractor called Public Good Projects, or PGP, which worked with Twitter to set content moderation policies surrounding misinformation, Fang reported. Bio provided $1,275,000 to the campaign, part of which is revealed through tax forms. The PGP campaign, called Stronger, helped Twitter create content moderation bots, select which public health accounts got verification, helped crowdsource content takedowns, he said, providing documents. Many of the tweets the Bio-funded campaign focused on were truly unhinged misinfo, like claims that vaccines include microchips. But others Stronger lobbied Twitter on were more of a gray area, like vaccine passports and vaccine mandates, policies that coerce vaccination, he added. Notably, this massive push to center and label COVID misinformation never applied to drug companies. When Big Pharma wildly exaggerated the risks of creating low-cost generic COVID vaccines, Stronger did nothing. The rules applied only to critics of industry, Fang wrote. You have to double-check that a recent tweet from Pfizer's official corporate account was actual and not from the slew of imposter accounts set up in recent weeks designed to tweet controversial statements under the guise of an authorized version. That tweet, which it turns out is indeed from its official Pfizer account, reads, "Wouldn't it be great if a few internet searches could land you a PhD? Thank goodness for real scientists." And underneath is a meme image of a man at a laptop with the statement, "Incredible. Area man now full-fledged scientist thanks to one internet search." The point is that Pfizer, the company that markets COVID vaccine Comirnaty and has borne the brunt of years' worth of disinformation on social media about its shots, has had enough, and instead of using the British royal family's line of never explain, never complain, is, through the power of memes, hitting back. Typically, Pfizer's tweets are, let's face it, pretty dull. The company is no Elon Musk or Donald Trump and plays it very straight with its tweets, something, of course, it and all pharma companies must do to remain compliant with tight drug marketing regulations. That tweet is a departure from the norm for its social media team. However, they had the excellent corporate sense to effectively stop any replies to the tweet by only allowing those who Pfizer tagged to reply, which of course was on one. There are more than 3,000 quote tweets where people can take the tweet and comment on it indirectly. Those tweets are overwhelmingly negative against the company, with people asking, "What are you afraid of?" by removing comments and attacking the company for what it has been perceived as a mocking tone. This comes amid a significant shift change for Twitter itself, with new owner Elon Musk landing in hot water with the pharma industry when his blue check subscription idea, which allowed anyone for a monthly fee to have the official blue Twitter check, backfired when one user, claiming to be Eli Lilly's official account and came with a blue tick, caused havoc for the company with a tweet declaring insulin was free. This cost the company billions of dollars in its market cap as investors reacted severely and saw Lilly and a host of other companies pause or rethink their Twitter commercial and strategy plans. That plan is now on hold, but it remains to be seen what the future holds for pharma on the platform. The latest installment of the Twitter Files reveals a disturbing connection between Twitter and Dr. Scott Gottlieb, a Pfizer board member who used to head the U.S. Food and Drug Administration. Gottlieb, FDA commissioner from May 2017 to April 2019, was a media darling during the COVID-19 pandemic, much like Dr. Anthony Fauci. Pfizer Inc. is one of the pharmaceutical companies that came up with 3 initial FDA-approved vaccines against the disease. Gottlieb joined the drug maker's board in June 2019 before the pandemic. The new information from inside Twitter shows how elites such as Gottlieb with connections to large corporations and the government can twist and suppress what gets to the public, warping society's ability to speak freely and find the truth. According to the Twitter Files, report released by former New York Times reporter and vaccine skeptic Alex Berenson, Gottlieb coordinated with the social media giant to suppress alternative policy recommendations for how to respond to COVID-19. Twitter at one time banned Berenson at the urging of the Biden administration, but the ban was lifted after he sued the company. He is now one of the relatively few journalists that new Twitter CEO Elon Musk trusts to disclose the social media company's previous internal workings in a series of Twitter Files reports. There was more. According to Berenson, Gottlieb reached out to Twitter to suppress a tweet in September 2021 that said, "Sticks and stones may break my bones, but a viral pathogen with a child mortality rate of about 0% has cost our children nearly 3 years of schooling." The former New York Times reporter noted that Pfizer's vaccine soon will be approved for children ages 5 to 11, a sizable market for the pharmaceutical giant. Berenson briefed Fox News Channel host Tucker Carlson about what his reporting revealed. Gottlieb and Twitter coordinated during social media's craze for affixing misleading labels at the height of the pandemic. Big tech companies not only were slapping warning labels on posts deemed harmful to the public, but outright suppressed speech that countered preferred media narratives. Recent information, such as what we see in Berenson's report, justifies the disintegration of Americans' trust in large institutions. For those who say, but Gottlieb was a private citizen, not a government official at the time, consider a few things. Twitter and Facebook also coordinated with the government, as other Twitter Files entries suggest. The line between private and public at the highest level is blurred now as government agencies cooperate with private organizations with smaller interests and ethos. It was profoundly irresponsible and outrageous for a tech company to censor information based on the desire of a single public health official who may have had a severe conflict of interest in the matter. And wrong on Gottlieb for using his power to shut up people he disagreed with, even if he thought he was correct. In the early days of the COVID-19 pandemic, the public and the experts didn't know much. Instead of trying to keep the free citizens of our republic informed with an acknowledgement of the limits of their information, the government and some companies use their power and platforms to manipulate and castigate. Did big tech companies have the authority to decide what was truth and what wasn't? It's pretty interesting going back now and looking at what was labeled conspiracy theory and censored during the pandemic. For instance, Facebook moderated claims that COVID-19 is man-made or manufactured. The idea that a strange new virus leaked from China's Wuhan Institute of Virology, and that Communist China, a regime with a loose affiliation with the truth, suppressed that information was crazy talk in need of censorship. Facebook stopped moderating this claim only when the Biden administration finally launched an investigation into the Wuhan lab. Facebook acted as if it were an arm of the Democrat Party and censored American citizens seeking the truth. The Twitter files, including the Gottlieb revelations, show how big tech companies, not the people, caused harm during the pandemic. They abused their position of power, thoughtlessly and perniciously silenced dissenters, and pulled Americans away from the process of discovering the truth. Big tech did this while destroying its credibility and the credibility of America's most important institutions, public and private, with all but the believe in science crowd. If there is a lesson in all of this, we shouldn't give all power to the scientific technocratic elite, and we shouldn't give big tech companies a pass for colluding with them. So, this was all from today's video. Make sure you have hit the bell icon for upcoming videos, and if you enjoyed this video, please leave a like and subscribe. Have an opinion about this? Share in the comments. Thanks for watching.